Welcome. My name is Beth Govero, and I serve as the Chief Nursing Officer here at Cleveland Clinic Abu Dhabi Hospital. This is our first podcast. Our podcast is called Nurse to Nurse, Bedside to Breakthrough. I have our first guest of our podcast, John Tote, Executive Director, and Lauren Sedgman, Nurse Manager. I consider myself a nurse's nurse leader. Our focus on this podcast will be that we'll be interviewing nurses from Cleveland Clinic, Abu Dhabi Hospital within our Nursing Institute. We'll talk on a variety of topics around diversity, what it's like to be a nurse in UAE, what it's like to be a nurse internationally, and all of the specialties we offer here at Cleveland Clinic Hospital, Abu Dhabi, around our nurses that provide care to our patients. We're here, we're very excited, we're very proud to be Cleveland Clinic Abu Dhabi nurses. I'm going to turn it over to John Tote and Lauren Sedgman to do their introductions and begin our first podcast.
Thanks, Beth. My name is John Tote. I'm the Executive Director for Inpatient and Emergency Services here at Cleveland Clinic Abu Dhabi. I arrived about 5 years ago. I came from the Cleveland Clinic main campus where I was working in the cardiac ICUs. My responsibilities here involve all of the inpatient services, which is the intensive care units, as well as the acute care units and the emergency department. And I also oversee the hospital transfer program as well as throughput for our hospital. Lauren,
Yeah.
tell us a little bit before we get into our critical care transport program. Tell us a little bit about yourself. How did you end up in Abu Dhabi all the way from Australia?
Hi, John. Well, first of all, thank you very much for having me as your first guest on the podcast. I'm very excited about this, a little bit nervous. How did I end up here in Abu Dhabi? It's kind of a long story, but I'll go back in time. I'm from Queensland, Australia, and hello to any Aussie viewers out there. I was born, I think, with a sense of adventure, being a country girl. After I finished uni, I actually moved to Melbourne, which is the big city compared to where I was from. And I did my grad year in the oncology, hematology, and bone marrow transplant suite there. So the Alfred is a large tertiary teaching hospital. So after that, I completed my ICU training, and I had a friend who was working for this brand new airline called Etihad here in the UAE, and I visited her. And so when I visited her, she was like, "Oh, it's great being a flight attendant." I said, "I have a very serious job as a nurse. I've just done my grad year. I'm going back to be a nurse." And then along the way, I had met a Scottish girl and decided I wanted to be a nurse in Scotland. I visited my friend on the way to Scotland here in the UAE. And long story short, went for an interview, got the job, and then started working as a flight attendant. So first in business class crew for 3 years, which was one contract back then. Completed that, had a little career break, traveled a lot, had a great time, and then went back to Australia, completed a couple of postgrad certificates, and then my feet were still itchy, so managed to go to Saudi Arabia after that. Worked in the neonatal ICU there at King Faisal, so hello to anybody who's from King Faisal. And then when the opportunity opened in Abu Dhabi, when Cleveland Clinic Abu Dhabi was opening, I applied, and I got a position in what was the clinical contact center, which was largely kind of nurse triage focused at the time. So that's my story of how I got to be in Abu Dhabi.
Wow, that's so interesting. I always like to hear the stories about how people arrived here in Abu Dhabi and the events around that. It's always interesting to hear that. So tell us a little bit about the critical care transport program here at Cleveland Clinic Abu Dhabi. You oversee that as their manager. How did that program come to be?
Okay, so yeah, our critical care transport team, I guess, was more or less born out of necessity. As a new hospital here in Abu Dhabi back in 2015, we needed to make sure our patients had access to the hospital, and we identified a need early on to be able to transport critically ill patients into the facility and around the country as well, so returning patients to their facilities. So more or less, our staffing structure, our policies and procedures, and our protocols and everything have been born from that need. So the identified need to move our critically ill patients and having a team who is competent and able to do that.
Great.
Mhm.
And who are the team members on the critical care transport team? It's not just nurses, right?
No, so unlike many places in the world, we don't have physicians on our critical care transport. We have two ACLS ambulances that are staffed with an EMT and a paramedic, and both of those are advanced in their practice as well. And we do have CCT nurses who are able to go on the transfers. So advanced practice nurses who are our CCT nurses who can go on transfers. Generally, that's for patients who have maybe an altered level of consciousness or a need for,
Mhm.
ICU care. So yeah, we can activate them to go on the transfers as well.
How many staff make up our critical care transport team? And then can you tell a little bit about the requirements if someone would like to become a critical care transport nurse or a caregiver here at Cleveland Clinic Abu Dhabi?
Yeah, definitely. So we have two of the ambulances during the day. So we have two EMTs, two paramedics on during the day. That goes down to a single crew overnight. We have 6 CCT nurses at the moment, and the CCT nurses are really outstanding individuals. This is not an easy job by any means. They have advanced practice in almost every area of nursing, really. So generally, they have their ACLS. They have their PALS certificate. They do advanced airway management. They do the familiarization with the actual vehicles, so being able to ride along in an ambulance and all the things that come along with that, breakdowns or what to do in the event that the electric goes off or something like that. So really, very interesting things. They also do cardiac assist device training because we do transport our ECMO patients. So they have to know all about the different ones like the impeller and IABPs and whatnot. So they really are very advanced practice RNs.
Wow. And share a little bit about some examples around some critical care transport trips that are requested of the team.
Okay, so on a day-to-day basis, we do anything from outpatient appointments. So there's a specific group, DOH may activate us to collect patients from their homes and bring them into the clinics or another area of the hospital. We may have discharges, so we're discharging patients that fit the criteria, and critical care transport. So we could go all over the country taking patients to other hospitals. For example, we can have pediatrics who are very unwell going out of the emergency department. Ladies in labor has happened on more than one occasion. Orthopedic patients, it's not a service that we have here. We may take ICU patients to other hospitals or to the airport to travel to different destinations around the world for care. We might be doing repatriation, so taking patients to the airport. There's really a wide range of cases that we're doing in addition to our retrievals. So we do deceased donor retrievals. That's when we're going and getting our deceased donor patients who are coming to CCAD to give the gift of life in our transplant program. So that's really so important. And so important that we send our team to go and get them because we want to make sure that pre-hospital care is just as good as the care we're going to be giving here at CCAD and giving both that patient and the recipients the best chance at life. So that's something we do. We also do ECMO retrievals, which is a really highly specialized, unique service. I don't think it's offered anywhere else in UAE to the extent that we do it. So yeah, all of those could happen on a day-to-day basis.
Very exciting role here at Cleveland Clinic Abu Dhabi Hospital with a lot of talented nurses that take care of the sickest of the sick.
Yeah, really, definitely. I think our ECMO program is one of the highlights, I think, and we've noticed exponential growth on the inpatient side for our ECMO program and the ECMO services. Can you talk a little bit about how the critical care transport team supports our ECMO program here?
Yeah, definitely. So we, during COVID, I would say this is kind of when it developed. We, as most really, tertiary hospitals or quaternary hospitals throughout the world would have had more demand than they would have had resources to look after these patients. So our physicians were getting all kinds of referrals and, we really wanted to be able to serve those people that we could serve as best as we can. And while we were limited, we were also finding other hospitals were limited. They couldn't release the staff to bring them to CCAD, or they might not have had the equipment that was portable. So what we did, the ICU physicians came up with criteria for those patients that we would be able to assist. So when they did the conference calls, they'd say, right, Lauren, we want to go and retrieve this patient. And it was not something we'd really done before. So it took a little bit of organization and, getting all of the regulators on board and whatnot. But we do have a very set procedure now to go and get those patients. So what would happen is the patient would be clinically accepted, and then we would communicate with the referring facility. So we use our transfer center as the hub, like for centralized communication. So we would do all kinds of different things. We would get the consent prior to going. We would activate the OR, the perfusionist, so cardiac intensivist go, a cardiac surgeon goes. All of these people, including our transport caregivers who are, bringing extra cars and helping to move equipment. We call ahead, we make sure the bedside's prepared. If they need an ultrasound or whatever, they've got it on hand. There's enough room. Blood products have been ordered. So all of these different kinds of things we're doing prior to going to get them.
So the team actually goes and does the cannulation at the outside hospital and brings the patient back.
Yeah, that's right. So we've made like a rapid preparation, so they can just grab and go. All of their equipment's already done. So they go, they place the patient on the ECMO at the other facility, and then bring them back in the CCT vehicle on ECMO. So yeah, it's really high tech. It's amazing. I think it's definitely contributed to our, I think it's the ELSO Gold Award that we were recently received, which is really great. So yeah, it's just something that, so interdisciplinary and requires such a high level of focus and skill, and something I'm so happy to be a part of.
Yeah, yeah, lots of coordination between lots of teams, and it's as we say in Cleveland Clinic, a team of teams comes together to make something like that happen.
Definitely.
Beth asked a little bit about the clinical qualifications for the nurses that want to be CCT nurses.
Yep.
What would you say are some of the personality traits that a successful critical care transport nurse might have? So we know that you would need a strong background in either critical care or emergency department. But what kind of personalities do our critical care transport nurses have, and what do you look for in a candidate if I wanted to be a critical care nurse?
Yeah, so obviously very advanced clinical skills. With that, I would say healthy measures of bravery, curiosity, willingness to meet new people, because you're going to be meeting new people, working in your environments every day, in different hospitals and whatnot. So, or going to retrieve patients, not working there, not staying, just to stop off. Also, working as a team member and being able to work independently is really important. Integrity and compassion, like we all have as nurses, but it's really resilience at the end of the day. You have to be ready to go at any moment, and that's the nature of the work. And some people really thrive on that, and some people find it challenging. But we're always here at the transfer center to receive any calls. If there's any challenges along the way, we can help iron them out. So it's a very supported role, but at the same time, you really do have to be have that personality that wants to get out there and go and make a difference every day.
Yeah, yeah. Such an interesting role. Makes me want to be a critical care transport nurse
Well,
now.
John.
I have an ICU background, so
you
could
do a great job as an
could do-
executive director, helping support the team.
For sure. Thank you, Lauren.
Yeah. What is I guess what's the farthest that we have traveled to retrieve a patient, and what is maybe a story that you can share that just you remember and just showcases the compassion and the excellent skill level that the transport team has?
So we go all over the UAE. I think we've been, to the far northern Emirates and whatnot. We've done an international one before, so that was obviously hugely coordinated and almost a national effort, to get this person back to the UAE. So a story that I think really touched my heart was in COVID times. As we know, ladies who are postpartum or recently postpartum were more affected by COVID. and becoming very ill. And so, going to retrieve patients like that is so special. I mean, it's giving me goosebumps now, but particularly as a NICU nurse, being able to bring in a young mother, treat them, and then get them back to their families is just, it's an incredible experience to be a part of. And obviously, what we do at Transfer Centre is unseen, and almost with the CCT as well. When it's done well, it's kind of an unseen thing. So we're just there and supporting the whole way, and that's how it should be. But it just plays such a critical part, and I don't need to be, the center of attention for our team, but just to know that we're able to do it is just so important.
Oh, that's touching. I love those stories.
Yep.
That to me really just brings us to what we do and how special it is, and why it's so important to have this team here for our country.
Yeah, definitely.
So, nurse to nurse
Yeah.
is, of course, the name of our podcast, but a nurse to nurse question, maybe that hopefully you can bring back your, peel back here is, who's been like a good mentor for you in your career, and what is some advice that you would give to nurses?
Okay, so a good mentor, very interesting. I've had several good mentors over the years. I think probably centrally it would be John over the last few years. It's not because you're sitting here, it's because you're really good. No, I mean, just, the trust that he places in me, and, him giving me the ability to do what I do on a daily basis with, obviously a lot of guidance. That's really been very supportive. So, what advice would I give to nurses? It is sometimes a very difficult job being a nurse, and sometimes you're making, really big decisions, or you're doing something really important and you feel unseen. And I just want everyone to know that, you don't have to be seen to make a difference. That needs to be like an internal motivator for you, and I've really found that is for me. I just get such a personal reward from doing the right thing at the right time, and yeah, it's a great career. I would recommend it to anyone. If I ever had a daughter, I would definitely want her to be a nurse. It is a rewarding career. So yeah.
Excellent. The other part of our name of our podcast is Bedside to Breakthrough. And you've definitely had a successful career and have really done that bedside to breakthrough of initiating our critical care transport team with the transfer center. What keeps you going? What's your why in what you do on a daily basis as a nursing leader?
So I think the story about reuniting the mother with the baby after, she's been treated, with such a critical illness, that is really my why. Because, if we can just be a part of that, and getting families back together and getting patients, back to their regular life, it really is just such a motivating factor. Also, I think every day I come to work is, we have our list that we're working on, and being able to make a difference to each and every patient on those lists, I think is just such a motivator. I think my team see me working through that, trying to individualize care, doing our best to make things maximally efficient for our patients. I think that when they see me kind of striving for excellence and in the pursuit of, doing a good job, I think that kind of rubs off on the people around you. And I do have a great team, and they are very hard workers, and we do have very high standards, and I think that that's kind of my why. I just really enjoy the work.
Wonderful. Well, thank you. Any other closing questions or anything?
No, I think we're just incredibly proud of all the work that Lauren and her team have done here at CCAD at Cleveland Clinic Abu Dhabi. And I think it's worth noting that all of this was built from the ground up.
Yeah.
So, when you arrived, Lauren, the infrastructure wasn't there. And so I think the work that you've done has built the program to where it is today, which is a really sophisticated program that's able to go all over the UAE and transport some of the sickest patients who can only get care at Cleveland Clinic Abu Dhabi. They're maybe at a facility that doesn't offer the level of service that we offer. So It's really their only shot at life is to be brought to a Cleveland Clinic
Yeah.
where they can receive the care that they need. So kudos to you and the team, both in the transfer center as well as the critical care transport team.
Thank you very much. Yeah, no, it's really a great team to be a part of. It's a great organization to work for. I'm so happy I made the choice to join Cleveland Clinic Abu Dhabi. And yeah, so yeah, what else can I say? Very
Excellent.
happy.
Well, thank you to Lauren and John for being on our first podcast. And I would say that there was no pressure. I'm sure you didn't feel any pressure.
Easy peasy.
You did excellent,
Thank
and
you.
appreciate your time during this podcast. In closing, again, my name is Beth Govero, Chief Nursing Officer here at Cleveland Clinic Abu Dhabi Hospital, and our Nurse to Nurse Bedside to Breakthrough podcast. Hopefully you'll continue to tune in and learn about our nursing here in the hospital and all the specialties that we have to offer and the great stories. I think the stories also, though, turn into our why. And sometimes in healthcare, we have to go back to the why and the purpose of why we do what we do. And so hopefully you took away some great information around our specialty of our critical care transport team, but also helped you find your why as well in being a nurse here in this side of the world. Thank you.